All right, U.S. health officials at the CDC have been ordered to cut off all communication with the World Health Organization. Last week, President Trump signed an executive order to withdraw the U.S. from the organization, a move that must first be approved by Congress. But CDC officials have already stopped their collaborations with the WHO, including research that could help contain virus outbreaks around the world. CBS News medical contributor Dr. Céline Gounder, editor-at-large for public health at KFF Health News, joins us now. Dr. Gounder, good morning. So let's just get to the heart of this and the worst case scenario. If there's another virus that spreads like COVID, does this put us at a disadvantage?
There is no question this puts us at a disadvantage. This is like stopping all military intelligence communications with our allies like the UK or France or Germany, where you would not be able to share information about what is happening on the ground, how we can be collaborating to address those threats. And there are active threats going on right now. For example, there's a Marburg outbreak in Tanzania. Marburg is similar to Ebola. We're not going to have the eyes and ears on the ground to know how that's evolving and what we can do about it.
So why would the Trump administration do that? What's their argument for doing this? And is it accurate?
They're taking a very isolationist approach, and this is not just about health. We're also seeing it across the board with conversations about withdrawing from NATO, for example. So some of this is isolationism, this idea that we can go it alone, which unfortunately we can't with some of these problems. We really do need to collaborate. We do need diplomatic approaches, and WHO is very much about international diplomacy, providing a way for Americans to go in with others to investigate these situations. The other piece is funding. So the United States supports about 18% of the WHO's budget. We also have Americans working at WHO proportional to our contributions. And that's how we get a seat at the table, is to be funding, to be part of the process. And by stepping back, we also lose that seat at the table and the ability to help shape a response.
So the CDC is not communicating with the WHO, but what is the relationship between the two?
They're very similar in that they have to respect sovereignty. So WHO has to respect national sovereignty. CDC has to respect state sovereignty. So they get called in to provide advice, technical assistance, funding sometimes, but they can't tell a country what to do or a state what to do.
Right.
Dr. Céline Gounder, thank you very much. Really appreciate it.